ran into a situation where you couldn't get something that you wanted or needed?
Like an expensive pair of shoes?
Or this fluffy teddy bear?
Healthcare issues have grown into a major problem in the U.S. due to lack of accessibility, portability, and affordability.
America must change its ways in order for citizens to get the medical attention they need.
Now, what exactly is healthcare? Well, according to Google,
healthcare means the maintenance and improvement of physical and mental health, especially through the provision of medical services.
This is in Obamacare. It was built on 3 promises. It was going to save families $2,500 a year, and the second 2 promises, one, if you like your plan, you can keep it, and if you like your doctor, you can keep it. So let me ask you this. Since the president promised that the average family would reap a premium decrease of $2,400 a year under the law, has that happened?
Obamacare was introduced on March 23, 2010. Its goal is to give more Americans access to affordable, high-quality insurance, as well as reduce the growth in our nation's healthcare spendings. Here are the 3 main problems with our nation's healthcare.
these problems are accessibility, portability, and affordability.
As shown by the graph, all health insurance premiums have increased over the years, and if action isn't taken to reduce these costs, they will continue to increase.
We spend 1.5 times more per person on healthcare than any other country, but we aren't any healthier for it. This is one of the reasons that insurance premiums have gone up 3 times faster than wages.
People may not be able to receive health care due to current medical conditions, and some people's insurance is canceled and bills are left unpaid as a result of their disability or illness.
This is as a result of companies caring only for money. Therefore, if a patient is in severe condition, they can refuse to provide them with insurance.
Accessibility also limits access to checkups, immunization, dental care, eye exams, and mental health care. Due to this, thousands of people die of preventable conditions.
The following chart shows that globally, the United States has the most insurance problems in all categories. Health insurance coverage is correlated with employment and becomes disruptive and inefficient.
24% of people who don't have health insurance have lost their insurance due to loss of job or change in employment.
People should not have to worry about what would happen if they're laid off from work, change employers, retire, or any other factor that affects their employment.
It's why so many employers, especially small businesses, are forcing their employees to pay more for insurance or are dropping their coverage entirely. It's why so many aspiring entrepreneurs cannot afford to open a business in the first place, and why American businesses that compete internationally, like our automakers, are at a huge disadvantage.
As displayed by the graph, healthcare spendings and cost per capita or per individual have increased every year. One of the things Obamacare ensured was affordable prices, which as you can see is increasing instead of decreasing. The cost of health insurance is increasing at a greater rate than an American's average wage. According to the Kaiser Foundation, from 2000 to 2006, overall wages increased 3.8%, whereas healthcare plans increased 87%.
Many Americans are only able to afford insurance because it is provided by their employers.
Out of the 84% of Americans who receive insurance, 60% get it through employers, and only 9% with insurance buy their own policies.
Wait. You didn't think we were finished, did you? There's still so many healthcare-related matters still left unresolved. One of these additional problems include hospital errors and infections.
During an interview with Dr. Wendy Levinson, she states, "I think there have always been medical errors. We just didn't pay much attention to it until the American report to Err is Human, Building a Better Health System, which, by the way, is more than 10 years ago. That report, published by the Institute of Medicine, really started to study the epidemiology of medical errors, and I think it set the stage for changing the conversation."
On one hand, recent studies suggest that hospital-acquired conditions kill more people than car accidents or diabetes. On the other hand, a report from the Health and Human Services Department shows that the death rate caused by poor hospital conditions has improved. However, hospitals need to find more effective ways to prevent infection from spreading.
Our nation is short of thousands of doctors, which is an issue that will only deteriorate with the increasing demand for healthcare for our aging population. Their population is expected to rise 101%, while the people who can care for them will increase by a mere 25%.
The shortage has really been driven by the aging and growth of the baby boomer population. So over the course of a couple of decades, you're talking about doubling the number of people over the age of 65. They're the people that use the most healthcare services from.
Lastly, apps technology and cybersecurity concerns a lot of people. Technology has introduced a lot of do-it-yourself patient care, which makes it easier for patients to look up their symptoms online, provide apps to help with special conditions, and simulate checkups, but this limits them to their qualitative and efficient healthcare procedures. There are always multiple differing standpoints for every issue. For instance, whether to repeal and replace the Affordable Care Act entirely or to just modify it.
Obamacare is going to be repealed and replaced. Obamacare is a disaster. If you look at what's going on with premiums, where they're up 45, 50, 55%.
In an interview with Lamar Alexander, the chairman of the Senate's Health Committee,
Obamacare should be repealed, finally, only when there are concrete, practical reforms in place that give every American access to truly affordable health care.
During an over-the-phone conversation with Assemblywoman Nancy Pinkin, she mentions,
People and I would support that we should keep the Affordable Care Act intact. It's going to take time to work it out. It's going to have to be adjusted.
during an interview with Dr. Cspan, this is what she had to say about the modification of Obamacare.
It has to be modified. I think it is a wonderful thought, but it's just that the fundamental structuring has to be changed.
As you can see, healthcare has become a highly controversial issue, which is why President-elect Trump should address this during his presidency.